To come on live, and then we're going to chat. Take Izzy back. I'm going to move my... That's my puppy making an appearance. Okay, so we're going to go live in just a few moments with everybody. We're going to get some comments up here in just a few moments as well. But for those who are just joining me, I'm Dr. Qazi. I do a lot with anti-aging. I do a lot with collagen. I do a lot with acne and scars and pigmentation. You can see this amazing result here at this point. This is one of the ones that I've done several years ago, a patient that I worked on about more than 2.5 years ago. So you can see really amazing improvement here for her skin. I want to kind of just showcase this one because I had a lot of questions regarding ice pick scars the last few days, rolling scars. This patient has all that. She also has a lot of volume loss. So you could take a look and see this process over here and just kind of what we had to do for her skin, for her scars. And also what's nice about this is a nice result over time. So I hadn't seen her actually in a little while, and then she came in again for, I think, some Botox or something. And now you can see just significant improvement. The skin quality is so much better. So just want to showcase this because it's something that, also people ask if we could show older patients sometimes what to expect if you are older. So here's a really nice example of that. So I'll go through kind of step by step of what I did for this patient. It was a lot of things, and it was done under multiple sessions of different types of things. So when people say like how many sessions, things like that, it's different sessions, like not necessarily the same thing over and over again, but other things that we did. So we did initially some TCA cross, we did talar liberator subcision. We also worked a lot on reducing. She had a huge cyst one time, and it exploded and it caused this big, large scar tissue, this hypertrophic scar. And I had to actually do some Kenalog shots, as well as through the laser tunnel holes, I put some steroid through the holes there. So that helped reduce the swelling there. You could kind of see it in the mid cheek there initially where there was like that ball that she used to have. So I improved that quite a bit too. So really amazing improvement here for a patient who is in her 50s at this point. But you can see just like overall, a process where even if you're older, we can improve your skin, and it gets better and better. So really, she looks younger now today than she did when she started. She looks younger than sometimes she brings her friends and things like that for other treatments, like sometimes for fillers, things like that. And they're younger than her. She looks their age. So it's awesome. Audrey's saying, that's the area of my face I hate so much that I'm dying to improve. Which area are you talking about, Audrey? Which one's bothering you? Not Shock is saying, I have these closed comedones on that area of my face. I'm using the BHA 2% Paula's Choice. You could try different cream. That could potentially help. And then do potentially like a glycolic acid once a week. That could be a good idea for you. Let's see here. Albeda is saying, is it one session of Subcision and Fraxel effective and worth it? What kind of scars do you have? I think that's what really matters, actually. Millennium is saying, wish I could afford services. We do have things for other budgets though. There's a lot of things that we could do, depending on what your budget is. It just depends on what kind of result you're trying to shoot for, how slow you want to go for. And we also do take pretty much every single, Care Credit and Alphion, and Cherry is really popular right now. A lot of patients are requesting Cherry. So we have a lot of those type of things that I think you should probably utilize because it's like interest free and just for several months. Let's see. Miriam is saying, what can I use for darkness around my eyes? You could do a little bit of Eucerin's anti-pigment cream like right over here, but probably the best thing around the eyes is going to be like the Pico laser if you just do it really carefully. So Breno saying, just use beef tallow and olive oil. No need for chemicals. Okay, so let's think about this. If there is a way that a topical cream even a prescription-based topical cream like tretinoin, for example, would be able to improve scars the way this did, I think everybody would do it, really. I mean, there's no question. I would love for that to happen. That would be amazing. Beef tallow, I think, is pretty terrible for people with acne scars, with acne-prone skin. I think it's going to really irritate patients, and you're likely going to get more acne. I mean, don't just jump on these trends just because a bunch of people, and if you look at it, they have like Amazon affiliate links, and they're all trying to push something out there, and they're raving about how beef tallow cleared their skin in like 3 or 4 days. It's is it possible that with hormonal fluctuations your skin clears up in a couple days? Yes, sure. But is it due to a cream? No. And I think it's really unfortunate that that's being pushed right now. I'm not like against natural stuff, I'm not, but like at the same time, it's like we just have to be realistic and honest. And this is just a trend that's been pushed by certain influencers. And really, I actually, so many people were asking me to go through it, and I was going through this stuff, and it's like the most ridiculous, ludicrous claims. It's like the kind of people that are a lot of these people in like the wellness community and stuff like this that make all sorts of claims about like how they do 100 different vitamins or something like that, and it kept their skin better and all this, and like that, and they're super healthy because of all these random vitamins that they're taking, and even though they don't they don't have any nutrient deficiencies, or people that push testosterone in men with normal testosterone levels, things like that. It's like some of this stuff is like really questionable, and really like, in order to do this extraordinary treatment, you really have to prove it, and you really have to showcase to people that there is evidence for this, because it's, potentially, especially like something like beef tallow, could break people out. So wouldn't really recommend it. And I tried so many different natural things, and I'm okay with trying things like that sometimes, if it doesn't cause problems. I told you before that when I was younger, I did lemon juice, and I put that on my face. First time it was helpful, then I did it again. It was terrible. It was really acidic. And then someone said mix it with a little bit of aspirin, uncoated aspirin. So I tried that. It seemed like it maybe helped a little bit again, but it burned really, really badly too. So I think my skin got way more sensitive from that, really, really sensitive due to that. And every single lemon has a different acidity. So it became really, something that I tell people about, because it's like, I don't think people know that just because something's natural doesn't mean it's good. I don't even understand what that means, because there's so many natural things out there. Heroin is natural, and it doesn't mean that you use that on for everything. So it's like it's wild. It's like opioids are it's a natural plant that's sitting out there. So it's like I don't understand what this means sometimes when people think that natural is somehow superior to something that's been rigorously studied. And in this case, for these kind of scars, this is something that like I care a lot about, to make sure that you don't waste your money doing other things. But there's significant improvements in this patient, and it's not going to be due to any topical cream. I could tell you that. She was on creams and things like that, but it wasn't due to the creams. Tony Santana is saying, if I don't want to do Bellafill, what's another alternative? Well, this patient, actually, we did do Bellafill, but she also did dilute Remedies. That helps a lot because I wanted to tighten some of the skin. If you have more volume loss, we could do something like Sculptra. Asian Spy is saying, would you know ahead of time how many sessions one would need just by looking at scars? I have a general idea. I tell you a little bit of that, but I don't typically say like that's exactly what it is. That's why I don't sell packages when it comes to scars. I just don't know what the overall. Some people respond so fast, and it's really amazing, and it's like, okay, in just a few months you responded so well, and maybe we don't need to do as much. So why would I sell you something that's like 3-6 sessions now of something that you improved in 2 sessions? Let's see here. Chico's saying, I did Bellafill on my acne scars, only last 2 days. Don't waste your money. It's a really, really interesting point here for Chico. So Chico is saying that he did Bellafill, or she did Bellafill, and it only lasted for 2 days. So Bellafill is not a filler. It's not the way you think. It doesn't work like something where it draws in water. The way Bellafill works is that it actually stimulates your own body's natural collagen. And really, you never want to overshoot it. It's a permanent filler. So you want to make sure that when you're placing it, you're not overdoing it, you're not overshooting it. And it's a permanent filler that stimulates your own body's natural collagen production. So as it goes down, there's an aspect then during that time period when your body starts making your own natural collagen, and then 6 months later, a year later, it gets better. I know because I've used Bellafill, first of all, in my own practice for almost 6 years now, and on my own face for just as long. So it's really been something that I'm very, very familiar with. I understand the product extremely well, and that's why I don't overshoot it. You have to be very, very careful as you do it. You don't want to just push it the way sometimes hyaluronic acid filler. This patient that came in today, he had gotten almost, I think, 20 something syringes of Voluma and Volux, and it was really unfortunate what they did to his face. He knows it. I talked to him about that already. I helped him dissolve some of the filler under ultrasound for him. But these products that draw in water, they can look really unnatural, especially if they're placed too superficial. And when it comes to scars, you do want to place it superficial. So it could look really terrible if you're using hyaluronic acid filler. And then people will say, well, why not use something like Sculptra or dilute Remedies then for certain scars? Well, the problem is that it's dilute. That's the answer. It's dilute, so it's going to spread. And I really care about patients' natural anatomy. I don't want to change your natural anatomy. I'm really, really good. I'm just going to say this. I'm really, really good at doing filler. I know how I do filler. I'm very meticulous, very careful when I do filler, and I really want to make sure I keep your natural anatomy, even if I'm doing it just for scars. If I'm doing it for scars, I'm trying to solve the areas where you have collagen loss, where you had some volume loss. That's where I'm doing it. I'm targeting it for that. And if we want something for more for facial balancing, I really am doing it for facial balancing. I'm not trying to change your natural anatomy. So, when I'm doing those type of things, I like to be very careful with the product that I'm using. So if I'm using something like Sculptra or Remedies in small little areas, it could spread. And really, anybody who says that it's not going to spread is just is not familiar enough with the product, doesn't have an ultrasound to see how it spreads, potentially uneducated on the subject, because it really will spread, and if it's dilute. But if you place something like Bellafill directly underneath the scar, you pleep it there, it's there. You don't have to worry about it. And so that's what I like about it. It's like just put something in there, you have some support there, and it's always going to be there. And I do use all those different products. I told someone today that I'm happy to use every single product that's out there, and I have zero relationships with any of these companies because I want to just pick the exact product that a patient needs. And I'm not like bound by some company where I'm obligated now to push some sort of thing because they have a sale. And I'll tell you, every single one, anybody on this side of things knows that these guys come to you and say to you that, there's a sale now for, let's say Sculptra. And if you do 2 vials, you get another one free and we'll support you for this, blah, blah, blah. And the thing is that it's like people get obligated sometimes because you over purchase some of the product from these guys and they give you such great deals sometimes for this. And so it's really problematic for people because it's like you end up doing these things and you end up doing the wrong product on a patient. So I do the exact product that's needed for the patient, the exact laser that's needed by the patient. That's why I have so many different lasers from different laser companies, because some laser companies do something very, very well and some don't do something very, very well. And it's just the truth. I'd like to go to people who are experts in certain things. Although I will say, one time I went to an expert, I thought, for hernia repair. And, I probably should have actually looked at it. I had an inguinal hernia and, he didn't even properly examine me. And it was unfortunate because it was I thought this guy did a lot of it and he was doing it all day long. And it was you look at these type of things, he's like a great training program, all this stuff. And at the end of the day, he didn't even properly examine. He knew I was a physician. So imagine now what it happens for patients out there. And he's doing that. He knows I'm a physician, and he didn't even properly examine me. In fact, he had his PA examine me initially, and the PA didn't do a proper exam on me. And then he's looking at me, and he's just like, "Oh, so it looks like you have a hernia." He doesn't even check me. He doesn't even do anything. And then on the day of surgery, I'm sitting there, and he comes in, and the anesthesiologist is there at the same time. And he's like, "So we're doing your left side?" I'm like, "No, we're doing my right side." And the anesthesiologist is about to just go put some, just to go knock me out. He's like, "Oh, okay, let me go check it then." And then he looks at it, and for right before I go to if they knock me out, he's just like, "Oh, this looks way worse than I realized." I was like, "That's great," So it's a part of this is that's why I want to talk to you guys about this stuff, because it's I want people even though I do a ton of this, I like the fact that I could showcase this for you guys and we could have this open conversation about the things that I could do very, very well. And I pay attention to this stuff and I'm really attuned to these things. And I want to say that there's some people, even like in my world, in my industry, who are sort of similar to this hernia doctor, and it's like they're pretty careless with things and they're not as careful with this stuff. And I see the consequences sometimes of that kind of stuff. And so it's like, just like, pay attention to this. Like if I was in your position, I would want someone who really, really pays attention to what he's doing or she's doing with your face. Because it's like, it's your face. I want it's like, I care about your face and I want you to be really, really confident and comfortable with your face. But like, it's really unfortunate that there's so many physicians out there who just don't pay attention to this stuff and like don't pay attention to little details. And like, I really care about like details like that. It's like, I want for you guys to do really well in life. Chico's saying, if we do Bellafill and acne scars and then we do microneedling once a week, does it affect our Bellafill? No, it's not going to affect it. Let's see here. Tony Santana saying 35 months after. Why so long? Well, I haven't seen her. I didn't see her in a long, long time. And then she came in for some Botox or some Dysport actually. So I ended up doing that for her. Zov is saying that's crazy and it's so common. A lot of physicians are careless. Yeah. So it is popular. Like it's really unfortunate actually. So it's like, and the best part is that they don't, they know I'm a physician. And like, just imagine like a regular person. Christy is saying you spend so long on one question. People have so many questions and you don't even get to them. Christy, I'm on every single night. So like Monday through Thursday. So if I miss your question, you could ask it again. And you can also ask in the chat again. I'm happy to go through it even, at some point. But I do like, this is what I do. Like, this is like, it's, welcome to my show. And I go on tangents sometimes and I talk about things and like, I don't necessarily answer every single thing. I try to get my best to answer everything. I do, but there's a lot of questions also on here. And sometimes I just want to spend some time in it. It's like, if you're sitting here and you're just watching a doctor rapid fire answer every single question, that's kind of, I find that would be pretty tedious to watch. So that's how I feel. But if, maybe there's some physician out there that's just going to answer every single question immediately as soon as you see it. And that'll be like, hopefully that'll help you out with whatever question you have. How old is this patient? This patient, she's, I believe, 53 years old. Let's see here. Serrano still saying, eat healthy food, eat healthy, cook your food, and use beef tallow if need be. Are you an influencer for beef tallow? That's my question. Are you getting paid by someone like to do beef tallow? I just don't understand. Like, this like being pushed by somebody, like some Amazon affiliate thing or something like that, to push beef tallow stuff. Like, I don't get this push for it. A few months ago it was something else. A few months ago it was something else. There's like something that someone pushes, and then people turn out that it's not really that great. And the thing is that like, I hate this thing. Like, yes, of course, eat healthy. Of course, do that. I'm a big believer in it. I really do try to pride myself in eating healthy. And like, I've like, ever since I was 22 years old, don't eat carbs at nighttime. I do a lot of different things like that. I'm a big believer in that. I don't eat dairy, or drink dairy, I should say. So like, as much as I could, sometimes ice cream here and there, but mostly I don't drink dairy. And it's like, I try to be very healthy. But at the same time, it's not due to like what you're eating for these kind of scars. Like, and I just hate when people say that kind of thing. Like, it's just like, and like, making sure that you eat well, or just tell people just eat well and your skin's going to get better. No, that's not the case. You have people, someone like this has very severe scars. Let me actually zoom in. You could actually kind of just appreciate the scars for this patient, this initial scars, and just look at what she has over here. And someone is telling us that all she needs to do is just eat healthy and do beef tallow. I mean, this is like, it's really unfortunate, really, and the best part is that like, you're talking to someone who does this all day long, does this for life, for life, gone through, had acne scars, everything like that. And then you're saying to me that all you have to do is do, a proper diet and take beef tallow. It's like, you have to wonder if someone is pushing something like that, like, what is the reason for that? Why are you pushing that? Because it just doesn't make sense. I don't get it. Look at those scars. Look at this. I mean, do you see the scars? Like, you're telling me just diet and doing beef tallow is going to solve that. Let's see. Miriam saying, what does stronger prescription of tretinoin produce more collagen? It will help more with a little bit of the oil production potentially. I don't know if it's necessarily going to produce more collagen by itself. Sometimes it's like going to particularly irritate it a little bit there. Let's see here. Albeda saying, one subcision and Fraxel for rolling and boxcar worth it. Well, it's not going to hurt you. I like that they're doing subcision for subcision. I like that they're doing it for boxcar scars. So it's probably a good idea. Fraxel is a pretty weak laser, but maybe your skin type, I'm not sure what your skin type is. Maybe it's necessary for that. So it's possible. How much is each session? Most patients spend about $5,000 to $7,000 for it, depending on their volume loss. This patient did end up spending more money than that because she had a lot of volume loss. So if there's volume loss, it does take a little bit more work to do. Rodo is saying, I've done 23 treatments. Come to me then. I'll help you out. I'll try to help you out with that. Let's see. Han is saying, is there a water filter for showers that you'd recommend? I have to take a look at it. Honestly, I definitely do think it's going to help you, though. I think hard water is a problem, honestly, and really it potentially delays healing as well. How does a proper examination look like? Well, anybody that goes to me knows I go through the scars really thoroughly, and I'll show you exactly what kind of scars you have, and like go through it with angled lighting and really properly. Even if we're doing virtual consultations, I'll circle the scars, I'll pinpoint the scars, I'll go through each individual scar and show you like what I see. And before, a lot of times when I walk in the room, I go through your photos and I'll go through and like map out how I'm going to do everything. That's why I spend my time a lot of times before I even walk in there. So it's like, I do all that before I even see you sometimes. Like I just will go through and like see, how am I going to do this? What am I going to looking at right over here? Chris is saying, what is the difference between Botox, Dysport, etc.? Everyone just says Botox. They're botulinum toxins. Dysport is just bound to a different protein than Botox. That's really the difference. Dysport is actually bound to something that's a derivative of dairy, interestingly enough. So if you do have a severe dairy allergy, potentially you can't do Dysport. But otherwise, I do find that it lasts a lot longer. Oh, I shouldn't say a lot longer, but I think it lasts a little bit longer than Botox. In general, I just find that like there's just been less issues with it, like with patients that I need to, like they feel like it's just enough for them. It's not too much, it's not too little. I really love it, honestly. That's what I've used every single neurotoxin except for except for the newest one. But beyond that, I've used everything else on the market, and it's like I find Dysport to be the best. So it's like I love still using some of the other ones here and there. You know, for some patients, especially if they have like botulinum resistance, Xeomin is a great product for that. But otherwise, I have great results with Dysport. It works really well. Zav is saying, why do ice pick scars form? I don't pick at my face and my pores are getting large as well. Well, it's probably oil production a little bit why your pores are getting a little bit large. But ice pick scars, honestly, it's just genetic. I see it more common with patients of East Asian descent. I don't know if you're East Asian, but I can see that more commonly though. And just saying, did you use vascular laser? I did use good eye. I did do that actually to even out her skin tone. Actually, she had a lot of redness there. So I did do XLV in her case. We did multiple sessions of XLV. So really, really nice. You can see that full, like it says right over here, this is 35 months after. We did some sessions initially, and then we just didn't see her again for a couple of years. And then she came in, and I was like, we just have to be able, like, please let me share your results. Look at your skin. Looks amazing. She's like, oh, it's like beaming. She's like, yes, it is. Like everyone knows, it's like says it's really, really great. And so she let me share it then. That was really, really nice of her. Can you do a live where you showcase just shallow texture and how lasers help with that? Yeah, I could do that. That's a good idea. I actually have also, I don't know if that's going to be ready for tomorrow, but I pulled up a bunch of papers on PRP for acne scars. It's going to be really interesting. We'll do a talk on that. So we'll give you a heads up before we do that. But that's going to be really cool actually, because I know that's a big question. A lot of people ask PRP acne scars. I just want to go through the studies, see kind of what's going on with that. Let's see here. I feel so Christy's asking thoughts on Rejuveron. Rejuveron's not bad, I don't think, but I've talked to other people who do it. They say it doesn't last too long. We don't have it in this country, so it's tough to really determine that. Delia is saying, I love the red light mask. I see a lot of improvement. That's awesome. That's awesome that you do. It does stimulate some collagen, so that's a good idea. Limp Bitsika is saying, can subcision cause sagging? It could in certain areas if you do it a certain way, like the lower part of your face. If you're using some blades over there, you could actually displace some of the pads over there, the ligaments basically that are supporting the fat pad, and that could potentially cause fat herniation where it bulges out. So I'm really, really careful in that area. Over in the upper part of the face, really low risk for something like that. But I mean, of course, if you're displacing fat, doing things like that, you could run into problems. Like anybody who does subcision with me knows I'm very, very meticulous with it. And I'm really like a perfectionist with this stuff. I really am. So it's like I go through it and I'm like, really finally concentrating and making sure that I could break up these individual scars. And if I'm doing it, if I do it and I just say it's done, because like I know where it's at. I can feel that cannula, I can feel the needle, and I've broken it up. And I use whatever tools I could use to break it up. Sometimes I use just tiny little needles. Sometimes I use thicker needles. Sometimes I just use a cannula. Sometimes I use a tailor liberator. It really just doesn't matter. Whatever I need to do is something called a Nokor needle. I'll use that too. And I'll use whatever it takes just to break up that scar tissue. Miriam's saying, I have trouble gaining weight on my face. Would fat transfer look natural? Yeah, it definitely could look natural. It depends on how much volume loss there is and which part of the face it is. Let's see here. Tears of Geisha saying that took 5 years off her face. I think so too. Yeah, I mean, maybe a little bit more than that. I think the scars aged her prematurely. And then when you look at this now, it really does look like she's younger than she was before. What can you do for the raised bumps? I have that. Are you talking about like as scars? It's a little bit tough to kind of say. Or is it raised scars, or what particularly is that? What would you recommend for minimizing pore size? You could just, as an easy thing to start, just do niacinamide. Just do that twice a day, niacinamide. The Polish Choice is a nice one. Start with that. That's not a bad idea. Delay is saying, I do microneedling. The scars are improved, but most people don't know how to treat it afterwards. Are treated afterwards are referring to the scars, like that you still see the scars and how to improve them some more. I could definitely help with that portion of things because, there's a limit to how much you're going to be able to do with microneedling. So hopefully I'll be able to help you with that part too. I know I missed so many different things. Let's see here. I missed if I got everybody's, but if I missed you, I think I did miss a bunch of stuff. But if I missed you, feel free to re-ask. Appreciate you, Cutie. Cutie saying we love you, Dr. Qazi. We appreciate you. Really appreciate you too. Thank you guys all, by the way. So it's really I like this community. I like this thing that we could just talk about, and I'm going to kind of tell you like some of the things that like I've noticed a little bit in this world. And hopefully it'll kind of guide you. And like, even if you're not doing scars per se, but you go to a physician. I told you yesterday about how my patient, she had a bad MRSA infection. She went to urgent care and they gave her the wrong antibiotics and put a steroid cream on her. Terrible management. So that kind of stuff is really unfortunate that it happens like over and over and over again. And it's just like, it's terrible, and it's like, I don't understand it. I don't understand how we're in this state in medicine right now. Tony Santana is saying, if I end Accutane in January, when would be a good time to start on acne scars? What dose are you on your Accutane, and how much do you weigh? Tichin is saying, can you help with acne scars on the back? Yeah, absolutely I could. They're a little bit more challenging. It takes a little bit longer to do, but we definitely could improve that though. It's just a lot of times it involves like Bellafill or something like now you could do like Sculptra, Remedies, things like that. You're going to have to do something like that to improve that. So consider that. But it depends, and on how deep it is. If it's just like pigmentation, that's also a lot easier, by the way. And so it depends on what's really going on. Do you recommend use of glycolic acid for hyperpigmentation? Yeah, I think it's great for that. It's typically though what I would do just once a week, and then use Eucerin's anti-pigment cream every day beyond that though. So just use that for like 6 days of the week, and then do glycolic acid once a week. That's a great combination really for a little bit of hyperpigmentation. It really works out well. Let's see. Tony Santana is saying that he is on Accutane 40 milligrams, weigh 100 milligrams, 180 currently, and was off of Accutane in January. Yes, we could go ahead and continue. We could do your scar treatments. That's okay. It's more like if you're just like recently, just like or currently on a high dose, on like the maximum dose, then I would back off on it and really wait a little bit while, especially if we're going to use more ablative ones. I'm saying our consultation's free. No, we do put you do a consultation with me. It does go towards your treatment. So just so you're aware about that. And then on top of it, this month right now, you do get 10% back. Just so you're aware, if you look at our website, it'll give you some information about that. Actually, let's pull that up because they mentioned that during a meeting, and I gotta double check and refresh myself here. Let's see here. Where was that thing? So if you guys go to drqazi.com, hopefully you guys do that. Let's see here. And if you go to the specials page, it'll have some things here. So let's see here. We have, it's a banner right over there. It says this month only 10% off each purchase. No membership required. Awesome. So there you go. You get 10% back. So there you go. So that's something that we're doing this month. So take advantage of it. Yeah, 10% off this month. And I never did that before. So it's going to be a short burst, short-lived type of thing there. So there you go. Like 10% cash back towards treatments, I believe. I don't know if anybody on here has done that already, but it's 10% back towards treatments. I'll give you the answer to that tomorrow. Actually, I'll try to look at that one. I actually know that they did talk about it yesterday, but I'll talk to you guys about it a little bit more tomorrow to see what's going on with that 10% off thing. Or call my office, and then I'll try to circle back with you tomorrow on that. So yeah, I guess I should have answered that one. I'll take a look and see. I'll take a look and see what the answer is for that. But it's 10% off. I know it's something that they never did before, and it's really good. T-Chan is saying, if we want to do a cure laser, is a 3-month wait between that and scar treatment non-negotiable? Is it possible to start treatment sooner? It is kind of non-negotiable because I really want to make sure that your oil is under control, your acne is under control completely before doing it. It's really for your own sake. Also, I don't want to overly dry your skin. So I found that 3 months is a really good sweet spot for that. So I guess we could talk about things a little bit, to talk about what's going on with your scars, what we need to do exactly. If it's like mild type of treatments, maybe we'll do it sooner. But more aggressive treatments, I do want to push it back if you did a cure. I appreciate you guys so much. I'll be back on tomorrow night. I know that there's some more questions that I may have missed, so I'll help you out again tomorrow. But yeah, 10% off on our website. Go take a look at that. I'll have my team kind of explain a little bit more for me tomorrow, and then I'll bring it up tomorrow with you guys. Thanks so much. Take care, everybody.